Morning, everyone. I'm Kadambari and absolutely delighted to welcome you all to the session and the webinar at large. Being a plenary, this session through deliberation seeks to focus on drawing out some broad currents on how we as donors or implementing agencies, impact investors, researchers, policymakers are thinking about behavior change communication in the clean cooking solution space, and drawing on our own lived experiences, so to speak, on what has worked, what has not worked, if it's not worked, why, and what are some of the directions for the future. Specifically, we want to take a pretty 30,000 feet approach on three facets. The first is, what are some of the design and deployment considerations of BCC campaigns? So what's the must-have elements of a successful campaign is the first facet. The second is, how can we use BCC campaigns to shift the needle from users, in the unclean stack space, so to speak, to more of a clean stack space? And the third is more of a future forward question saying, can BCC catalyze urban consumers? Can it catalyze cleaner adoption in urban consumers, and what this would actually hold in terms of rural consumers actually shifting to clean cooking solutions? And very importantly, is it too early to be talking about this? And if it's not too early, what are some of the red flags that we should be aware of? We have a powerhouse of panelists, and each of them have eclectic backgrounds, multiple years of experience working on different aspects in the clean energy space, and they all wear different hats. And I would request each of them to sort of briefly delineate their work in the space. Swati, founder of Sustain Tech, if you could go first, that would be great.
Thanks, Kadambari. I'm Swati. I wear multiple hats as I have been doing for about a few decades now. Besides being founder of Sustain Tech, I'm also the president of the Clean Energy Access Network and also chairperson of TIDE. In these roles, when we've looked at biomass energy implementation at the grassroots, we have had to address issues of technology, issues of consumer behavior, and towards the end comes issues relating to behavior change when we realize that everything else is okay.
Reema ji, who's director of Seva.
Good morning, namaste. It's been a great honor and a delight to be on this panel. And I work at the Self-Employed Women's Association. We have close to 2 million women members in India. We also work in the neighboring countries, and I think in order to reduce the drudgery of the women workers in the informal sector, how does clean cooking play an important role in that aspect? And therefore, we have been quite instrumental in bringing clean cooking methods, clean cooking fuels, and clean cooking adoption into the rural households across the country. I look forward to the rich discussion. Thank you, Kadambari.
Ganesh Neelam from the Tata Trusts.
Morning, everybody. This is Ganesh Neelam. I've been working with the trust for about 16 years now. Mainly work in the livelihood space in the trust in the Central Indian tribal region. Also look after the small energy portfolio that we have within the trust, and to see how we can horizontally integrate energy into agriculture, education, healthcare, and other things. Clean cooking, I would say at the trust, is a new engagement. It's been only a few years that we have engaged in clean cooking. But for the reasons for us to engage in clean cooking has been because our engagement closely with the large communities that we work across India, and we work in all states of India presently. And to understand the challenges, the needs, and the aspirations of these communities, clean cooking came up as one of the important aspects when we were engaging with the women mainly in the communities. And that's the reason we are now trying to see how we can address some of these challenges that the women face with some good quality solutions and the overall ecosystem in cooking. Thank you.
Dr. Debajit of Terry.
Good morning. So I'm Debajit. I work with the Energy and Resources Institute, leading one of its division, the Rural Energy and Livelihood Division. So in Terry, we have been working in the clean cooking sector for quite some time. Initially, starting with designing improved biomass cookstoves for the rural areas. But since the last about a decade or so, we have also started implementing clean cooking solutions in the rural areas of different types, not just in the household, but also in small industries like the restaurants and dhabas and other places. This one, we have different type of stoves, including biomass stoves, forced draft stoves, which we have designed in Terry. And in the last few years, we were successful in implementing almost 100,000 stoves in some of the states in India, with support from different organizations and agencies, but primarily with working with the Bihar Rural Livelihood Promotion Society, which the self-help groups themselves has financed these stoves for the women-led households. And I think we have implemented around 70,000 of them in the state of Bihar. And that has been a major achievement on our part. We are now planning to scale it up to have 200,000 stoves, with also trying to get some carbon fund for that and see how we can do it. So thank you.
Santosh from IntelliCap.
Hey, good morning, everyone. Thanks for inviting me for this panel. My journey in clean cooking has started almost like 15 years back when I was working with Event Foundation on a working group which got resulted into creation of the GACC, now Clean Cooking Alliance. And since then, I've been working in a number of roles as a researcher, as a part of the donor team that has been implementing some of the clean cooking initiatives across the world. So I would be talking about my experience through these different roles, which includes working with World Bank to create a large RBF and clean cooking interventions across South Asia, as well as working with GIZ, where I tried to set up a forum for clean cooking, India Clean Cooking Forum, which is still functional. And in my current role, I work with IntelliCap, where I head the energy, climate change, and agriculture initiatives. I also lead a kind of initiative that focuses on behavior change for climate change. And beside this, the group has a couple of investments into the clean cooking space. So I'll try to see what my learnings can contribute to the discussion. Thank you.
Thank you very much. Each of these questions to a few of you. And once we garner initial thoughts, request the rest of the panelists to jump in, and would love for this to be a chai pe charcha. So, and so multiple perspectives, conflict is great. So if we could just have an informal tenor to this and a back and forth, that would be lovely. So diving right in, to ensure a continuum of change in the user from awareness to adoption to sustained usage, we know that BCC campaigns would need to be very carefully designed and deployed. And I want to deconstruct this design and deployment consideration through the next set of questions. So first, Ganesh, to you, what are some of the learning questions that you ask yourself or what guides your thinking when you're designing a BCC campaign? So what are some of the learning questions that we should keep in mind when we're designing a campaign?
Based on our experience within the trust, and because we mostly engage with the rural and tribal communities, and within them, again, mostly with women. And this is, again, not only for clean cooking, but also the other programs that we are into, like livelihoods or drinking water sanitation, which again has a very strong link to BCC. Our strong learning has been, unless and until you empower the communities and you engage intensively with them, you basically cannot impose any, say, technology or say thought process within the communities unless you try and build in an engagement with them. And that engagement takes a considerable amount of energy, time, and you basically need to be patient to do that engagement and work with the communities. So some of our learnings vis-a-vis BCC has been, how do you look at that empowerment within the community? And when you are doing the empowerment, you see some triggers with the women leaders coming up and trying to have more engagement with you. So use them as your basically mascots to engage with the larger community and see how then the dissemination happens within the community. The second important learning has been that you need to work on a phased manner and on a long-term horizon rather than saying, okay, I'll only engage till I am basically implementing my product or my engagement in that area. But you need to look at that long-term horizon and regularly keep on evolving. So it has to be a dynamic process vis-a-vis BCC that we have learned again within our program. And so that's been something that we have focused and are engaging within the communities. We saw something very exciting, like in our programs, we do something called Urja events, or we do something called Mahol building. Now, these are some triggers which basically encourage community to come upfront, have their questions, clear their doubts, and then that engagement continues. So that's been something that we have focused at the trust, even in the clean cooking space. What we basically did is with the institutions that we have created over the years, we basically superimposed clean cooking program on that institutional structure. It already had a base, it already had a strength. So it also helped us in a way to be on an easy path to get in to those communities and build on a clean cooking engagement or a program, wherein BCC then becomes fairly easy. I would not say completely easy, but fairly easy to take it to the next level. So broadly, this has been our learning, Kadambari, and we are regularly learning. So it's not something that we have already learned. It's a learning phase that we are into currently.
Santosh, I know you've been in the research M&E space for a while now, and we know that evidence research is critical to the design of BCC campaigns. In your experience, what data ground up are we using effectively in designing these BCC campaigns, and what is the kind of data that we don't have, or we have but we're not leveraging it effectively?
Before I answer that question, just to kind of clarify that when we talk about behavior change campaign, my understanding is that behavior change intervention is the larger set and behavior change communication is a subset of that. So just to highlight that not all the behavior change outcomes that we are looking can be achieved through behavior change communication, because there's a lot of other things need to be done. Having said that, one of the critical things that we have learned over the time that, the behavior change campaigns or the interventions are probably the 20% of the effort in order to be effective. You need 80% of the effort on the focus of understanding what behavior we need to change. And while it's very simple to say, I need to identify what behavior we need to change. The problem is that we don't get very robust data to understand what behavior we are looking at. And this you will probably hear in other panels as well, but we have relied on the data that had been collected through some qualitative surveys, some quantitative research, some observational research. So there's a lot of data, but the reliability of data and some of the other biases have been a big problem in kind of understanding this, the behavior change problem. So for me, one of the key things is that to spend as much time understanding the people, user, product, the supply chain, the economics of that, so that when you get the data, you see the data in a context. Often we see data in a silo. I'm talking about a consumer acceptance primarily from the convenience point of view, but I ignored the data on the fuel supply in that area, which is very erratic. So you might see the response from the consumer coming from convenience point of view, but it is being driven by the fuel available there. So having a contextual understanding of the data on all the critical variables that affect behavior, be the product, be the fuel supply chain, be the economics, be the convenience, is critical. Now, having said that, the data is available, the tools are available, there is a mechanism to get that all in place, but often we are in hurry to design the campaign. So if we, and I'm myself, kind of victim of that whole mentality. We design program and we say 2 months of preliminary research and you have 6 months for designing the interventions. We learned that probably we could have done it otherwise. put 6 months in research and 2 months in designing. So I think, just to quickly answer your question, yes, data is available, and increasingly data is getting more reliable and more available from multiple type of sources. Earlier we relied on quantitative survey or qualitative surveys. Now we have very reliable data sources coming from multiple other sources. So data is increasingly available. Second is that we have been able to kind of now use different methods to validate the data. So availability of data, reliability of data is now established. Then we are kind of looking into using the data. So yes, the data is available. I would say that when you think of a campaign, spend more time in getting to understand what behavior you want to change and how you can dissect that behavior using multiple data sources, check the reliability of your understanding. Because if the hypothesis is not right, I don't think that campaign would be very effective.
So what I'm hearing both Ganesh and you say is it's a patient investment, essentially. And it's a lot of time spent in prep work and a systems approach to actually, I think, designing and coming from a monitoring, evaluation, learning perspective, I would say that the way we need to design the MEL architecture of these programs needs to be one which is embedded in complexity, I think. So it's a really good takeaway to say that, QEDs or just qualitative is not going to work. So I'm hearing you say patient investment, and going back to Ganesh's point, iteratively re-looking at probably what even behavior is and whose behavior we need to change. And the next question that I have, and I'm going to start with Debojit on this, and is at the risk of sounding simplistic. And that's a caveat right up front. We know that every stage, whether it's awareness or adoption and sustained use, we know that a behavior change, a communication campaign and intervention needs to have a balance between talking to the user about the product and also talking to the user about the practice or the behavior. Debojit, do you find that in, say, awareness, you are heavier on one aspect, say product, whereas in sustained use, you are heavier on, say, the practice component and less on the product component, or am I being very simplistic?
I think both are equally important, but then it depends on what you want to do and at what stage. So I feel different aspects like income, social position, cultural practices, food habits, gender dynamics within the house or within the village, all these influences BCC. This one, while income might influence the purchase or of the stove or the connection of the LPG stove, this one. So I think cultural practices, food habits and other things might be more important for the adoption or the usage of the stove. Let me give an example. We in Terry, when we started promoting improved cook stoves, and we were promoting forced draft improved cook stoves at as an independent product in the rural areas. And we were not finding enough takers for that product because somebody has to pay for it, and also this one continue using it. This one. So what we decided is that we were finding that our solar home systems or the solar lights were much more this one in demand in the Bihar and Jharkhand and also all these areas than the improved cook stove. So what we did that for the initial purchase of the product or the this one, we combined a single product started calling it integrated domestic energy system, where a solar light was integrated with a cook stove. So you get both the thing. So you have a solar panel, a charge controller, and connected to solar light and also the fan of the forced draft cook. Now the solar light was the primary, I would say the choice for the consumers, that they were preferring the solar light, but they know that if they have to take the solar light, they also have to take the cook stove. This one, and then nobody objected to that. They're very well, and we could promote almost 25,000 such devices in the state within a very short period of time. Now that helped us in entering the house and providing them with a cook stove. But does it mean that they have started using the cook stove? I think the BCC for adoption should be designed in a different way, because it might involve more social practices, food habits, gender dynamics and other things, who is cooking, who is buying the product, all such things. So I think design have to be according, this one have to be made accordingly. So in short, what I feel is that what Santosh also mentioned is that clear understanding of the local is extremely important. You can't just copy something from a different area and start immediately replicate in another area. So you have to first understand what is actually needed, what type of BCC we should design, and for what purpose. Now, depending on the purpose, I think the design should be made, and accordingly, is a stepwise thing that at different steps you might have to change your BCC depending on the need. And not all villages might need the same BCC again. Within a given district also, or within a given state, different districts might need different BCC modules depending on the local specifics. And we don't have patience to have to design according to the local specifics. We always try to standardize things. Standardization is extremely important. In our program also, we standardize a lot of things, but I think standardization is important after customization. And then you standardize the process of implementation, not necessarily the standardizing the entire thing.
This is great. And coming to, Swati and Rimaji, your insights on how do we ensure sustained usage of the product? So you incentivize them, there is awareness, there is potentially an adoption, you understand, in situ dynamics. But then how do you incentivize me as a user to continue using the product? So just Rimaji and Swati, maybe we could have Rimaji first and then Swati. Your insights on, say, sustained usage.
I think I would fully agree to what Devajit Bhai said, and that is that if it's a need-based or if it's a demand-driven BCC, and then the uptake is there. But I think one also needs to really understand. I was just talking to one of our leaders, and she said that if my kitchen is a clean kitchen, I can definitely will be living in peace. I would be freed from the drudgery and the torture that I have to go through. Now, listen to the words she says, drudgery and torture. So every woman goes through this unless her kitchen is a clean kitchen. And I think in order to for her to sustain the usage, we need to understand what are their needs, what are their demands, and then if we arrange the whole supply side accordingly. If the clean cooking devices or clean cooking fuels are available at my village level, very often there is an initial incentive so that there is an uptake. But then how do you sustain it? Because I have to travel a few kilometers to for the refilling of it or for the repairs and maintenance, and that again becomes a hindrance or that becomes a constraint. So unless and until it's affordable, it's available at the doorstep, and it's very easy to replenish it, refill it. I think that's the biggest incentive that and I think we only see women as users, but we have to see women in all different aspects. She becomes the owner, the user, the manager. So she's not just the user, but how does she manage the entire cooking in her own household? And I think that's the biggest thing that we will have to really look at. One interesting thing that we have been trying is that what's the role of the self-help groups? And I think, there are so many collectives in the villages, and how can they become the agents for distribution, maintenance, refilling, and they know very well what's the affordability of each and every household or each and every woman and her household. And that's where if the self-help groups become the distributors or the agents of the clean fuel or the clean cooking devices, then I think we would be able to really sustain it in a better way. It's not that women don't know anything, and we need to continuously keep educating them. Every woman wants to really have move up the social ladder, but nobody tries to invest in the process. I think unless and until you invest in that process, And that's the biggest incentive, I think.
Swati, I'm just going to change that question slightly for you and move to the second question and then get your insights. I think because it's a nice segue with where Rima ji ended. I want to talk a little bit about this pervasiveness of stacking that we're seeing, right? I mean, our report said that 75 to 80% of households are using traditional cook stoves along with a clean cook stove. And we know the policy and the research agenda is shifting from programs focusing on one fuel device to multi-clean fuel devices. At the same time, going back to Rima ji's point, we know that users have a relatively definite preference, right? Saying that I want to use LPG for making roti, but I'm going to use an ICS for heating water for a bath, and I might use firewood for creating, for say, livestock preparation, food preparation. How do you see, and in your work, how are you using a campaign to influence users to move from a dirty stack to a clean stack? And that clean stack could have multiple clean options. So how do you see BCC playing out in shifting that needle?
As I was listening to all these conversations, took me back about 20 years when my mentor, Professor Reddy, said, must always think global and act local, and that message has been with me right through all these years. And the other thing that I have learned in the process, I think, is the fine art of listening, that we must go to the community as equals or as inferior so that we listen to them and not talk down to people. Because the moment you do that, then everything else in your behavior change campaign would get, nullified, because then the relationship is not established. So these are the two things that I always keep in mind whenever, if I'm designing a research or if I'm doing any behavior change campaign. So if you're talking about a clean stack, I'll just give you an example of a conversation that I had a couple of years ago with a vegetable vendor, and this reflects the way she has taken a decision about her stove stacking arrangement. She had an LPG stove, and she said that I can spend about 15 rupees per day on my fuel cost. But if I am sitting and selling vegetables for 30 minutes more in a day, I make 30 rupees. So it is a trade-off between how much. At the end of the day, it is a financial decision. Any behavior change, whatever it is, if you do not address the cost of cooking aspect of it, it becomes very difficult. So then she had to opt for a decision about when to use a stack. When does she use LPG? When does she use firewood? It depended upon how much time she had in the day, etc. So it was, maybe she would go back and say, in summer I am going to use more firewood, post harvest I'm going to use more firewood because there is a lot of agro residue. In the rainy season, and when my business is ripe, I'm going to use more LPG. So these are the kind of things that we have picked up by listening to consumer. So if there is a choice that she has to make between stacking, and we have to push them into a clean stack, we must give them all the elements of the clean stack. It could be, I think, three types of stoves I've seen commonly in rural areas now: induction stove, the LPG stove, and the traditional stove. I do not see the improved cook stove very much a part of the behavior change discussions when we are having interaction with rural communities. But sure, if you give them a stove that works and meets their needs, then it comes into the stack. So how do you bring a stove into the stack which is really clean is also another question that we need to be able to ask. What is affordable? What is economical? What is when? It's a very complex set of decisions that they take.
I just have one follow-up question, and I'm going to start with Santosh here. There are a lot of studies which, as I said, which talk about user preferences for certain types of fuels or stoves for certain for certain specific needs, right? Cooking, bathing, etc., heating water for a bath, etc. Do you think BCC campaigns have actually leveraged this data and said that for the same activity or for the same usage and purpose, let me tell you the delta of using an LPG over firewood? Do we have that kind of data, and have we leveraged it in when we are going to the community?
So, Kadambari, I think a lot of research has been done on the kind of stoves and their performance in terms of calorific value and how they reduce the time, how they save the fuel, how convenient they are. So yes, there is a data, and one of the most common behavior change campaigns that have been done, whether effective or not, is to highlight the economic and time-saving benefits of the options. If I look at the hundreds of the campaigns that we design, I think each campaign would have some element where they will talk about that if you adopt this cookie stove, you'll save 10 minutes of time or 30 kg of wood in a month. So yes, these data have been kind of used, but and they have not been that effective. Just keep in mind that since we are discussing this today, and still we are not able to crack that formula that okay, this is how the behavior change campaign should be run and it will be effective, because it's still a work in progress. And the reason why this is work in progress is that somewhere we miss the key problem. The key problem is a users struggle to choose something that is better than the traditional option. And the traditional option scores on three fronts: convenience, habit, and cost in most cases. Now, when you can shift this equation, and this is sometimes we have tried to shift this equation by one variable, we say, okay, it is healthier, might not be as convenient, is kind of clean, but it's not as economical. So the answer is yes, we have the data, but it's not as simple as just saying that this is better than that cooker stove on two counts and that person will switch. We have done that ad nauseum. Results have not been that effective. The reason is that there are so many variables that we do not focus on. So a choice of a cooker stove is often decided by a number of variables. What Swati was also mentioning, that availability of fuel, sometimes there is an inertia that I cook something on this and cook something on other things, different uses. So this again goes back to my first point, the granularity of understanding that why a person is using a particular option is critical. And all of these probably add to that. The last point I would add here is that whenever we talk about, it's not about moving towards the clean stack. It's about reducing the use of dirty stack. You don't put the problem upside down. The problem is not that we are not using a clean cooker stove. The problem is we are using dirty stoves. So how we can, all the health problems are happening because we are not using the clean stove, but we are using the dirty stove. So there have been cases where we have got the adoption data where we say these many households have adopted clean option, but the data on whether they have stopped the dirty option tells a different story. So I'll just sit here because we need to also look at that, not to sell more stoves, but to tackle the real problem, have the user stop using the dirty option.
So I'm going to move to the next question, and then, and I would love all your perspectives on this. So we know that in recent times, the major strategy of the government to help rural India transition from, say, a traditional cook stove to a clean cook stove is being the provision of LPG. So there's a big push being given there. But we do know that this is a monumental task, right, to get everybody moving to providing LPG. So at the sound of at the risk of sounding risky, an argument can be made that if urban users can move from LPG, which is a clean stack, to another clean stack, it would free up LPG cylinders for distribution in rural areas, and that could sort of hasten their adoption of CCS. So the question that I have, and I'm going to start, I think I'll start with Ganesh here. Has BCC or have we actually done enough thinking on some of the levers that we need to focus on to trigger an urban user to move from a clean stack to a clean stack? How difficult is that? Because I'm already in a good place. So what are some of the levers you think that we could use to target the urban user?
As you mentioned, the LPG movement, which happened because of the Prime Minister's push, and then a lot of urban users basically gave away their LPG subscription to actually move it to the rural areas. But see, what I suppose we also need to understand, even in the urban population, there is a mix. So you have different sets of people in the urban population, and you are also now seeing a lot of migration happening towards the urban areas, which is again from the rural areas coming into the urban locations. And there again, because these families are migrants, they have a challenge of looking at something substantial at their end within the urban setting. But I would say at the urban area also, there has been only a small percentage of people who understand the challenges. Say, for example, giving away the LPG and it benefiting a rural or a tribal family. The understanding is fairly limited. Everybody even now wants to hold up and keep that source with them. And again, it also has this connection of a BPL card or an APL card and all those connections, which all of us basically feel, no, I am getting some benefit from the government side, so I will want to keep it and continue using it. So what has happened, I suppose, the government pushed again in terms of getting numbers of urban users giving away and the rural users increasing in terms of LPG. But it only happened on paper. It only moved on a number on a very small scale. There has not been a continuous engagement with the urban users as well to make them understand. Like we are talking about the rural area where an improved cook stoves could be brought in. Like Santosh mentioned, moving from a dirty stove to a clean cook stove, we are trying to push in that space. But in the urban areas also, it happened at a small level on a campaign, and then it fizzled out. So there has not been much engagement, focus, and effort towards making the urban also understand how it would be beneficial for them. What are the incentives that the urban family can get? Like for example, if I'm giving LPG, what is the incentive that I get when I buy a microwave or I buy a induction? Now those connections are something which are not built in. So always I feel why should I give away? So that's at least my understanding in this case.
Dr. Devajit, is from your experience of working in Terry, what is your experience of BCC and helping urban consumers make, in quotes, wiser choices, or choices which would actually allow for a quick transition of the rural populace to move to a clean cooking stove? How, in your understand, how has that worked, and what are your thoughts on that?
I would answer it in a different way. This one. So in urban areas, I think everybody uses a clean cook stove, whether it is an LPG or at least cleaner cook stove. This is an LPG, microwave, induction, whatever it is. That means think about the slum area, but in general, this one. So I think what we are proposing is that we have to have clean cooking and less household air pollution in all the areas. Now, to make an impact in the rural areas, we have to do BCC, behavior change communication for the urban areas to pay a pollution tax. So we are proposing, and we have proposed to the government, that to increase the number of refills in the rural areas. The government has provided 80 million connections, but hardly less than 50% have actually adopted the LPG. That means regularly using LPG. This one. So we are saying that to make it a regular usage of LPG, there should be an additional support for the extremely underprivileged population in the rural areas, this one, who can then adopt an LPG, because the typical willingness to pay is around 320 rupees per refill. This one, whereas the refill cost now about 550 or something like that. So the gap needs to be addressed as a temporary measure by the government. Now, if the government does that, then there would be a reduction in household air pollution, leading to a reduction in ambient air pollution by almost 25 to 30% as per WHO study and different other studies also. Now, if that impacts the urban area, then from where the money will come? So the government doesn't have any budgetary provision for that. Will not make any budgetary provision for that. So to make it a revenue neutral strategy, we could put 1 rupee cess on petrol and diesel, which would yield about 34 billion Indian rupees every year, which is sufficient to provide 7 cylinder refills to the rural population, the PMEY consumers, every year. So that would cost about 34 billion Indian rupees. So we have worked out the calculation, and if the government does that, immediately the refill will increase, which is corroborated by the fact that during the lockdown, the refill increased from less than 1 on an annualized basis to around 6 on an annualized basis, because the government provided free refills to the PMEY consumers for 4 months. And at the same time, the ambient air pollution in the northern India region will reduce by about 25% at once. So it's a win-win scenario for both the urban population and the rural population. And in the process, we'll make the homes clean, not just in the urban areas, but also in the rural areas. So that's our proposition that we have submitted to the government, trying to raise awareness on that. And of course, whatever money has to be generated by the government have to be ring fenced. Otherwise, the government might take it away and use it for their budgetary fiscal deficit, addressing their fiscal deficit. So that has to be ring fenced so that consumers don't mind, the urban consumers don't mind paying that pollution tax, keeping in mind that it is doing something good in the rural areas. And could be a roadmap that how you can reduce it over a period of time. And as people in the rural areas start using LPG, I think they will get habituated in using LPG, and somehow they will manage the money in future years.
I'm just going to read out these questions at least because, so the first question is, are there any basic factors to keep in mind while standardizing BCC for all villages? I think this goes back to Dr. Debji's point of saying, can we do customization first and then standardization? And the other is looking at, the use of certain type of a fuel in terms of performance. But right, so I think that unfortunately, we need to wrap up. And just final thoughts from Swati and Rimaji on the BCC for triggering the urban users to move from a clean stack to a clean stack. And what are your thoughts on that? Maybe Swatiji first and then Rimaji.
I've always been thinking of a rural stack. I've not done much thinking on the urban stack because urban people can afford to pay. Even if you're going to give them whatever says the budget says, it's all fine. As long as they can afford to do so. But the focus has to be on cleaning up the rural stack. And for that, if you look at behavior change communication strategies, I would think that I would be more process-driven than product-driven, saying that there are a certain few key messages that you must tell people, but target your messaging not at the women who cannot take as much of a decision as the family. Target your behavior change campaigns on the family, make it supportive for women to take a decision. And focus on both a purchase decision and a recurring daily use decision so that they move towards a clean stack.
Thanks for being such a fantastic panel. And just to quickly summarize, we're looking at patient investment. We're looking at listening to the target audience. Standardization comes after customization. And we need to keep in mind, it's complex, so we need to look at holistic ways of designing as well as evaluating BCC campaigns. It's been absolutely great, and then I'm looking forward to interacting with you all later during the day. Yeah, thanks so much, and thanks everyone.